The next innovator in our cohort is Babylon Health. Representing Babylon Health is Claire Morris, International Programs Director.
I am with you. I am with you from London. Just one second.
Perfect.
Perfect. Great. Thank you very much. It's a real pleasure to be joining you and to be joining the cohort, and really exciting to hear from both the other innovators who are joining with us at the same time, as well as your existing cohorts. So thanks very much. So I'm representing Babylon Health. We are a UK based digital health company, founded with a mission that I know will be in absolute alignment with everybody else on this call, and very much in alignment with the Innovations in Healthcare network. So we were founded in 2014 to make healthcare more accessible and affordable, and really using mobile technology, digital technology and AI to try and reduce cost and increase accessibility of healthcare worldwide. This just gives you a quick sense of the size of the organization. As I said, we're UK founded, starting to grow into a number of other countries. We have a large team, nearly 2,000 now globally, in a range of different locations, and we are in our sort of Series C funding round. So Babylon has taken the model very much of thinking about users, patients, customers, however people think about it, at our center, and what type of healthcare needs they will have throughout the course of their life, whether it be from when they're sick and needing to understand their symptoms and needing specific healthcare services, through to supporting people when they're recovering or managing a longer term chronic condition, as well as to how people stay well and healthy. So we're looking at kind of this whole circle of everything that's comprised in healthcare, and looking at what we can do and address initially through somebody's mobile phone or via AI models and tools, through to then virtual services, i.e. telemedicine, and obviously the referral into physical services to ensure really appropriate customer and patient journey and an integrated and holistic approach. So what it looks like, and I'm just going to initially refer to the way in which we're working, for example, in the UK, where we kind of have our full model up and running. This ranges from as an entry point, and we have an app which is available and free for anybody to use in the UK, which has an AI symptom checker, which is we have a huge team of data scientists, epidemiologists, and doctors and engineers who've worked on an AI model. And the entry point is a symptom checker, which asks questions and interprets your symptoms via a chatbot interface to give people recommended actions as to what they need to do next. That can then link in the case of the UK, we have a telemedicine service, which is both private for corporate and insurers, but also very importantly and increasingly at this moment in time, we run that service for NHS registered patients as well. So people can book a consultation and have a consultation with a GP anywhere they are. And as it happens, our GPs obviously are able to provide those consultations from home. We also have a health check or a health assessment, which takes somebody through a series of questions to develop a kind of a holistic view of someone's health, including their history and their family history, to then give them an assessment of the current their current health status, their risks, and some recommended actions for improving their risk, mitigating those risks in the longer term. And we're moving into, we now have a health management platform focusing on longer term chronic condition management, starting with diabetes, with a whole personalized care plan to support people in a holistic way with a condition like diabetes, ranging from obviously their nutrition to exercise to their consultations and appointments. What we've been doing is we have this sort of integrated and holistic approach, but we work differently depending on the market and depending on our client. So just to give you a few examples of the way in which we're working in Southeast Asia with a large private insurer called Prudential, and we have adapted two of our products to fit in within their health ecosystem. So that is a kind of localized for for 11 countries in Southeast Asia, localized by epidemiology, by language, by cultural appropriateness of the language, and also by, for the sort of recommendations and the actions to understand the health infrastructure in each country, so that the type of actions that our AI will recommend will depend on what type of services are available in any individual country. Second one is our relationship with TELUS, a large telecommunications provider in Canada, where we have a joint offering, both of our AI as well as with the with GP consultations, which are funded through the Canadian health system. Here in the UK, as I mentioned, we work very broadly, including our large GP at Hand, which is a virtual GP service working to support the National Health Service. And then we have an adapted model for our service in Rwanda, where we are actually using feature phones, and we are integrated within the National Health System, which I will refer to in a little bit more detail now. So just to underscore the importance, and I think this reference is actually a question that was raised during my colleague from Demagi's presentation, which is around regulators and standards. We obviously adhere to all the regulations and standards that currently exist for these types of products, both in the UK and in every single market that we go into. And indeed, our AI and data science team have been engaging with WHO and IiH, who actually have a working group on building sort of international benchmarks for symptom checkers. So not only are we adhering to everything that currently exists, but also engaging to try and support the ongoing evolution of regulation for these types of tools and products. Babylon's second country after the UK, which is, I guess, a sort of slightly unusual thing for a commercial company to do, was to go to Rwanda. We were invited into Rwanda by the government of Rwanda because they are a very visionary government with a very clear idea of what they wanted to achieve in terms of universal health coverage and how to leverage digital technology to support them in their ambition to provide quality healthcare to everybody in the country. So we set up, in essence, a telemedicine service in Rwanda, based in Kigali, where we have a call center with nurses and doctors and call center operators to really maximize those health resources for the most people across the country in all socioeconomic groups and all regions. So we set up in 2016. Since then, we've registered over 2 million people in a population of 11 million. The team have provided over 1 million medical consultations and trained a wide range of people, from doctors to nurses through to teams working in health centers. And very excitingly, and this is hot off the press, only a couple of weeks ago, we signed a 10-year contract with the Rwandan government for provision of health services through our model, with reimbursement from the Rwandan Social Security Board for greater integration with the system, as well as starting to use our AI in the call center as a triage tool. So the way it works is, as I mentioned, we're using feature phones in this particular case. So we have a simple USSD app. It's very quick and easy for people to register. We have integrations with the National Identification Agency and the Rwandan Social Security Board. Once somebody is registered, they can then request a triage consultation. That's usually within 5 minutes that they get a call back from the triage consultation. The nurse goes through what somebody's specific issues are and ensuring that they are quickly referring them to a district hospital if it's an emergency, to self-care if that's appropriate, or for an onward consultation with us if it's within our license. They would then get a call back either from a senior nurse or a GP for a full consultation. We're integrated within the public health system. So if somebody needs a prescription or a lab test, they get a unique code sent to their feature phone, which that can then be redeemed at a number of facilities across the country. And this gives you the sense of the coverage that we have. We've integrated with over 418 health centers, public health centers. These are health centers in Rwanda, where our portal is available within the health center. The teams have been trained so that the patients can access their medication and lab tests should they require and get the relevant follow-up. Obviously, partnerships here have been absolutely critical, and it's a range of partners across the health system. In the case, the health system and the sort of foundational teams such as Ministry of ICT and the Rwandan Development Board, as well as private sector providers as well. Very important, obviously, to understand from an external perspective who it is that we are serving, as well as how our patients view our service. And we did we contracted Dalberg with support from the Gates Foundation and USAID to do an impact evaluation last year to help us understand both how our service compared to conventional care, whether we were really making a difference to the speed at which people were accessing care, and also who were we reaching? Are we really having the extent of accessibility that we were aiming for in terms of both gender balance, the age of our patients, and obviously a representative sample across socioeconomic groups? And we're very pleased with that coverage and hoping to do even more under our new contract with the Rwandan government, which is where they're funding us to provide services to everybody under the Mutuelle scheme, which is the poorer segments of the Rwandese population. Now, in terms of where we go next, and I'm focusing more on our work where we're reaching more underserved populations as opposed to our sort of more commercial expansion, which has gone into the US, extending across Southeast Asia and the Middle East. We're looking at other countries where we feel that we could be working with governments primarily to enhance national health systems and to support them to achieve universal health coverage in a cost-effective way. We've been looking obviously at critical components of each market and really looking within this network to really get additional advice and support, as well as potential partnerships to help us look at expanding into other countries where digital technology could really enhance a national health system in this way. But we're also looking at kind of our overall global product roadmap, how that product roadmap can be adapted for lower income groups, how we can leverage partnerships to look at ways to use our technology, particularly our AI tools, to support existing organizations that are working with underserved groups, and how our technology can support the infrastructure and further enhance the services that can be provided to extend more customer-facing AI tools to increase accessibility and quality of healthcare. Thank you very much.
All right. Thank you, Claire. We have a number. We don't have a whole lot of time for questions for Claire, but I can maybe ask one or two. One question is, what's the revenue model? Do you charge per user, per transaction, or something else?
So the model varies depending on the market and depending on the payer. So in the UK, for example, where we're working with the NHS, we obviously work on a capitation fee. So it's per registered patient per year. Where we're working in Rwanda, that's going to be on a per consultation basis. And then where we're working with private providers, let's say in the case of insurers with Prudential, that's on a license fee, and that's based on a model of per user per year. But in most cases, we have obviously a few private subscribers to the service in the UK, but mostly it's the service is usually free to the user, but they are being covered by a payer, which might be a government, might be an insurer of those kinds.
One participant asked, have you reached a break-even point, and if yes, how long did it take?
It's a good question. the answer is we're expanding so fast that no, not yet, because obviously, like many technology companies, we've been continually investing in our expansion, both geographically as well as in our product. But our team in Rwanda have been doing very well in this regard. And maybe if you want to contact me separately, I'm happy to share a bit more information.
Great, thanks. And one final question, I guess, is sort of, you've got an audience here, or the IiH network community. I guess how can the network help Babylon expand? Yeah, in their strategy.
Yeah, so, and as I kind of referred to in my kind of final two slides, I think we're looking at two things. One is obviously where we can go into other countries and look to sort of replicate what we've done in Rwanda. So looking really at a sort of national scale services. So really insights and views of others as to which countries they feel are sort of readier for these types of interventions. And then secondly, and very much coming to the point that, Demagi made as well, of kind of where others in the network see that our technology could be integrated, could help enhance, or could, complement what they're doing, and what are those sort of opportunities where they've already got reach, infrastructure, users, community health workers, really excited about, conversations with Demagi and others in the network about those sorts of opportunities for partnership.
Outstanding. Well, thank you so much, Claire, for presenting Babylon Health.